All right, let's jump right into this explainer. Today, we're separating fact from fiction when it comes to your prostate, bladder, and urinary tract health. You know, urology is one of those fields where old wives' tales and internet rumors just run absolutely wild, and honestly, that can lead to some very common yet entirely unnecessary health anxiety. So today, we're going to be your enthusiastic guides through the actual clinical science, breaking down what's real and what is just a persistent myth.
So, here's our roadmap for today. We're kicking things off with prostate puzzles, moving right into bladder behaviors, and then wrapping it all up with the great cranberry conundrum.
Section 1. Prostate puzzles. Let's clear up some of those massive mysteries surrounding men's prostate health.
Now, a super common and honestly highly anxiety-inducing worry for older men is getting an elevated PSA test result back from the lab. PSA, or prostate-specific antigen, is just a routine blood test. But man, when those numbers come back high, panic sets in immediately. The very first question is usually, wait, does this automatically mean I have cancer?
Well, take a deep breath because a high PSA level is not an automatic cancer diagnosis. Not at all. Actually, medical sources point out at least 8 other entirely benign causes for a raised PSA. Things like a recent urinary tract infection, a super vigorous workout, or, simply getting older can make those numbers spike. The PSA test is a fantastic tool to signal your doctor to take a closer look, but it is definitely not some definitive crystal ball for cancer.
And hey, one of the most common benign causes is BPH, or benign prostatic hyperplasia. Now, hyperplasia is just a fancy medical term that means an increase in the number of cells. As men age, the prostate naturally grows. It's incredibly common, but because the symptoms, like having to pee all the time, can mimic way more serious conditions, it causes a ton of unnecessary worry. So really recognizing the facts here is an absolute game changer for your health anxiety. BPH is primarily a quality of life issue, not a life-threatening one. It's entirely non-cancerous. For the vast majority of men over 50, it's just a totally normal part of aging. Once we understand that an enlarged prostate is basically just a standard biological reality, we can completely strip away the fear and just focus on simple, everyday symptom relief.
Moving right along to Section 2. Bladder behaviors. Let's shift our focus to those everyday habits we all have, especially when navigating incontinence.
So if you suffer from urinary leaks, it seems perfectly logical to think, hey, to prevent leaks, I'll just drink less water, right? Less fluid in means less fluid out. Makes sense. But is that actually true when we look at the biology of the bladder? Actually, scratch that whole idea, because here is a highly counterintuitive fact. Restricting your water intake absolutely will not solve incontinence issues. In fact, it usually makes them worse. See, when you drink less water, your urine gets super concentrated, and that dark, concentrated urine is incredibly irritating to the lining of your bladder. That irritation causes the bladder muscles to literally spasm, which cranks up your feelings of urgency and can actively cause even more leaks. Staying properly hydrated with water keeps the urine diluted and keeps your bladder nice and calm.
Okay, now what about this common habit? You're on a long road trip, or maybe you're stuck in back-to-back meetings, and you just decide to hold it in. It feels like a totally harmless display of willpower, but is that actually safe for your body in the long run?
Urology experts are crystal clear on this one. You should absolutely not hold your urine for prolonged periods. Just don't do it. When you constantly ignore that urge to go, you are physically overstretching the bladder muscle. Do that enough, and over time, your bladder might actually stop emptying completely when you finally do make it to the bathroom. That leaves stagnant urine sitting behind. And as we're about to see, stagnant urine is literally the perfect breeding ground for bacteria. All right, Section 3, the UTI and cranberry conundrum. Let's unpack one of the most famous urological remedies in the world. We've all heard it, right? From our grandmothers, our friends, every corner of the internet. Reaching for cranberry juice is the ultimate natural shield against a UTI. It's practically treated as medical gospel at this point. So let's look at what the rigorous clinical science actually has to say about this little red berry. Well, it turns out the science actually does back up the folklore, at least partially. One major review of research suggested that cranberries can reduce your risk of a UTI by up to 30%. That is a pretty significant drop, particularly for non-pregnant women dealing with recurrent infections. Now, for a long time, people thought this worked because cranberries made your urine super acidic, supposedly killing off the bacteria. But researchers found out that's actually not true.
The real magic lies in these specific compounds called proanthocyanidins, or PACs for short. These PACs basically act like a microscopic non-stick coating for your bladder. When those villainous E. coli bacteria try to anchor themselves to your bladder walls to kick off an infection, the PACs make the walls way too slippery. The bacteria literally can't stick, so they just get flushed right out of your system.
And while researchers do note that there's moderate to low certainty in the broad data, mostly because study designs vary so much, there are very clear benefits for symptom reduction. Biomedical scientist Christian Morrow points out that taking these cranberry compounds reduced symptoms by more than 5 times. 5 times! That is a massive quality of life improvement if you're someone who suffers from recurrent UTIs.
So if you're choosing between drinking the juice or taking supplements, there are definitely some trade-offs to consider. If you go the juice route, you have to ensure it's 100% cranberry juice, not that sugary cranberry cocktail stuff. But you know, even pure juice is naturally high in sugars and calories. Supplements bypass all that sugar, but urologists warn you really have to do your homework. You must ensure your supplement uses soluble PACs extracted directly from the juice. Some of the cheaper supplements just crush up the leftover seeds and skins from the juice-making process, and those simply won't absorb into your system properly. If you do decide to go that highly targeted supplement route, urologists have a very specific recommendation. You want to check the label for exactly 36 milligrams of PACs. That number is the clinically observed sweet spot to get that awesome non-stick bladder effect we were just talking about. Oh, and remember, if you're taking a pill, you absolutely must drink a couple of large glasses of water with it to mimic the natural flushing effect of the juice. Okay, but we do need to talk about precautions, because just because a remedy is labeled natural does not mean it's free of side effects. Cranberry juice is highly acidic, right? So it can severely worsen symptoms for folks with a painful bladder condition called interstitial cystitis. Plus, cranberries are high in salts called oxalates, meaning chugging too much could actually lead to kidney stones. And this is incredibly important. Cranberry products can interact with blood-thinning medications like warfarin, leading to really dangerous bleeding risks. Always talk to your doctor before adding heavy supplementation to your daily routine.
So here's the absolute bottom line on the whole cranberry conundrum. They are a fantastic preventative measure. They can absolutely stop the bacteria from sticking in the first place, but they are not a cure. If you already have an active infection where the bacteria have taken hold and multiplied, slippery bladder walls are not going to save you. Cranberries simply cannot replace proven medical treatments and antibiotics. If you have active UTI symptoms, you need to see a doctor. Full stop.
Hey, if you're enjoying this explainer and finding real value in separating these medical myths from the clinical facts, please be sure to like and subscribe to the channel for further explainer uploads. We absolutely love digging into this complex medical literature and breaking it down for you, so your support truly means the world to us.
As we wrap up this evidence-based journey today, from prostate anxiety to bladder habits, all the way to the truth about cranberries, I want to leave you with something to think about. Look at your own daily routine. What other deeply held health facts are you blindly accepting without actually checking the science? Keep questioning everything, keep learning, and we'll catch you in the next explainer.